Brandon. How are you?
Good.
Good
It's
to
nice
see you.
to see you.
So I just wanted to say thank you so much to Dr. Frye and her whole team, because this hydrowave therapy has really reduced my pain level in my body. And you know, from someone who just thought it was going to be part of my daily life, this just chronic pain, okay, I can't overextend my elbow, to now I can do it without thinking about it just like I used to. So thank you so much, Frye Chiropractic. Hi, Dr. Martin. So how does Hydrowave work?
That's a great question. And really what it is, it's known as shockwave or low energy ESWT. It's new to the technology in America. It's been in Germany and other European countries for years and years. And they found such great results that now we're starting to see a huge explosion in this therapy in the United States. And really what it is, it's relatively simple, and it's a very supersonic sound wave that goes into the tissue. And you've already noticed that when it finds sore areas, that's where it wakes up that dormant tissue and does three incredible things. Number one, it triples the amount of blood flow to that area, which is great. It helps recycle the damaged cells, which that's what's necessary for healing, get rid of the bad cells so the new cells have a place to go. And it really activates the cellular response at the area that your body needs. So whatever that tissue needs, whether it's more muscle, more bone, more ligament, more tendon, more nerve sheath, whatever is required to really have a full expression of health and healing, you get to receive.
How many treatments do you need on average?
On average, it's relatively quick. Most regenerative areas that need regeneration will typically take in between 8, 10, or 12 treatments to have that full expression of healing.
Is it once a week or twice a week? What do you recommend?
Most of the frequencies are once a week, but at the beginning, sometimes it's good to kind of capture planting some new cells there. So in the first 2 weeks, typically it's a 2 times a week protocol for the first 2 weeks. And then after that, once a week until we get the desired results.
Is there a maintenance?
Absolutely, especially with maintenance. And you're asking all the right questions. So with certain conditions, especially that are wear and tear and progressive, like osteoarthritis and different wears and tear from the joints, sometimes it's necessary to support that good healing. And especially if people are returning to those activities, such as golf and going up and down the stairs and just doing the things that, maybe aggravate a knee, or maybe playing racquetball again, or pickleball or tennis, and those tendons are constantly getting aggravated. Typically, once a month is required with maintenance for some of these progressive conditions to just maintain that high level of health.
So I was in a car accident a couple of years ago, and then about a year ago, I hit my funny bone twice, and then it just kept hurting and hurting. And I asked Dr. Frye, do you think this could be from my car accident, or I'm just getting old? And she said, no, it's probably from your car accident, because I was gripping the steering wheel. And I thought, gosh, I'm getting old. Like, I hit my funny bone. Like, how many times do you hit your funny bone over the course of your life? And it hurt, and I could not hyperextend my elbow. And I could just do this. And then I just noticed with just activities of daily living, I was compensating and using the other hand because it just hurt to do this. And I've had a series of probably about 16 treatments now.
Yes.
And like, it's 90% better. I wouldn't say totally 100%, but I can do everything with my left arm again that I couldn't before. And I didn't think it was possible. I thought that was just my new normal. Like, you're old. This is what's happening. You're degenerating.
And that's why I'm so glad you're continuing to get that healing, just continuing to get up to as close to 100% as possible. But it sounds like you had a pretty serious condition when all of a sudden that the joint gets restricted. So it sounds like your extension of the elbow was, 80 degrees or so. That's pretty serious, and it's good we're catching it now, because and undoubtedly it's not just hitting the funny bone. We've all done that. I would agree with Dr. Frye that it's probably more to do with the accident. Scar tissue had been built up. And that's the great thing. This limits the amount of scar tissue, helps break down those adhesions in there and really bring more of a cellular response and healing to those cells. And again, allowing that expression of full range of motion. So congratulations. And now it's just enjoying good life and good working hands, and, and not compensating with the other side. So good for you.
Yeah, because I'm a surgeon, so my arms and my hands are really important. And I was kind of compensating by when you operate, you're kind of stabilizing your arms this way. So I don't usually have to hyperextend, but living my life, I have to do that by carrying something or lifting. And I would like carry a bag and do it on the other side. So I was probably giving trauma to the other side by overusing it too.
Now we can be balanced, and now it just really, like with part of the phases of care, this is very much a passive modality given to you. But once you get those full movements into the joints, you can start returning back to activities in the gym and start lifting and doing things that you want to do that will really support that healing and really getting more strength and tonicity around that joint that has been restricted before but now full. So that's fantastic.
Interesting is that I was having an exam with Dr. Ray at Dr. Frye's office, and he said, "What else was affected?" I said, "My right shoulder, there's a little tear, and then my left knee." And then I thought my left knee, I did physical therapy, I thought I was fine. And he said, "Is there anything weird?" I said, "Well, when I do yoga, the patella, like it moves a little funny." And so he touched it and he said, "It hurts right here." And I didn't flinch. I made sure I didn't flinch. And I said, "How did you know?" He's like, "It just feels that way." And so he's going to have me do Hydrowave because he thinks it can help. I didn't realize there was a weakness of the medial aspect of my knee.
Well, it sounds like you're just starting your journey with Hydrowave. So congratulations on such a good response for the first joint, but also just some accelerated healing into that shoulder and into that knee. I'm hoping and thinking good thoughts for everything to get up to hopefully close to 100% as possible.
Thank you. It was nice to meet you.
It was great to meet you too.
Dr. Martin, can you just talk about the distinction between hydrowave and other shockwave machines?
Sure. So with different shockwave machines, I think that a lot of them stand out. In the industry of shockwave, there's a lot of different subtitles. There's piezoelectric, and then there's radio, which is more of an air compressor. Then there's electrical magnetic, which is electrical into a magnetic coil. Then you get to the next phase, which is called electrical hydraulic, and then magneto hydraulic. The one that's hydrowave is the very top, and because it stands out for a couple of reasons. One is it's not as loud as the other machines. Number two, it has some of the deepest penetration, the most millijoules of energy per millimeter squared into the tissue, which is what's necessary. All the different shockwave papers that have been written, they always want to get as much energy deep enough into the cells because that's what's required for the cells to truly heal, is the currency that really gets these cells to cell signal the body is the millijoules. And so Hydrowave gets the most in there. It's very comfortable because it's a focused wave. Just like you're a surgeon, it's like bringing a needle right in, and it's the smallest gauge needle. When I say smallest gauge, it's just able to get in there into those tissues. Some of the other shockwaves are a bigger gauge of energy, a bigger column, and some of them are quite painful. Some are loud. And as a doctor, we're always concerned and we're always conscious and aware of how the patient's receiving the treatment because it's so important in cellular healing. Because if you can be able to relax the patient, getting them into a parasympathetic state, which means rest and relaxation, they receive the energy better, and we've seen such a big improvement in their outcomes. So there's a lot of reasons why we've endorsed Hydrowave, from patient care, comfort, doctor getting great results, and some of the most energy in the industry. That's why we've picked Hydrowave.
It works. Like, it's not an ad for Dr. Frye. Like, it really helped me, and I didn't think it would, or I didn't know anything could. So I'm very happy.
That's why I'm so passionate about it. Believe it or not, I was in a bad accident in 2016, was going to require surgery. So as a doctor, I had to retire from practice. Been a practicing chiropractor, 3 clinics, very, very successful. And now I needed to get a double laminectomy and a full cage in my back from an accident. I came home in a walker, and I just found stem cells, got stem cell injections into the disc, into the ligaments. And then once I got the new products in there, then the shockwave machine was able to support those cells and really get that healing that was required. And because of that, I was able to be healed. So I'm standing in front of you from 2016 to now, which is very rare with a lot of lower backs that are pretty crippling, pain-free. I'm able to go and work through the day, stand all day, sit all day, whatever I need and require, work on patients and train. and I have no more pain. So, Doc, it's very similar to you. It's absolutely amazing. That's why I'm so passionate about it, because I just want to help more people kind of regain their health naturally. And if they can't do this in a natural way, then we have surgery to back it up. And I've also seen that getting the shockwave to clean the environment prior to the surgery and then supporting post-surgically, no matter what they're getting, I've seen huge improvements with the cutting down of the rehabilitation time. So that's why I think with healthcare and shockwave, we can all work together, right? Because it's all for the best of the patient.
It's nice to live life pain-free. That's a big thing.
It's a gift. It's a gift.
It's a gift. When you're young, you don't realize because you just bounce back from everything. But after 40s, 40s and then 50s, it's harder.
Yeah, I'm with you.
Thank you, Brandon. Thank you, Dr. Martin.
Thank you, Doctor. My pleasure. Yeah, excellent. Well, have a great day.